So for this video, we are going to be doing a prehab and injury prevention sequence for training our posterior muscles. So for this, we're going to be using the 3-pillar approach, which is going to be mobilization and lengthening, activation, and finally integration. So for each of these points, I'm going to give you a couple exercises, and then we're going to demo it, then I'm going to expand on it. So to begin with, we have our mobilization and lengthening. So keep in mind that for most people, you're going to be very quad dominant, which means basically the quads are going to be really tight and overactive. As a result, your hamstrings are going to be lengthened and probably not as active, although still active. With quads being tight and dominant, your hips are also generally very tight and restricted. When your hips are restricted, your glutes are going to shut off or not be as active as they should be, which is quite common in lower cross syndrome, for example. And finally, your calves are likely going to be very tight. So with this in mind, we are going to go into a mobilization sequence of rolling out our calves, our hips, and our quads. We're going to do a little bit of rolling on the glutes as well, just for as more of an activation than a lengthening, but we're going to go into that in the next step. So we're going to start off by foam rolling out our calves. So again, we can use different foam rolling techniques. We have the cross friction technique where you're moving side to side, and then you have our spanning technique where you are sweeping your leg, pivoting on that point which the foam roller is digging into your muscle belly. For calves, you want to focus more on the main muscle belly of the gastroc, which is further up. I find that the cross friction and spanning works really well here, especially if you have knots in your calves. And as you're rolling back down towards your ankle, you're going to reach more tendon, and here you can flex your foot to get a little bit deeper in to that tendon. Next up, we have a foam rolling for our quads. Same idea. You want to move nice and slow as always, side to side, going across those muscle fibers. I find that the spanning technique works quite well, especially as you're coming down to that teardrop muscle close to your knee. You want to really start relaxing into it and trying to get that foam roller as deep as possible. Finally, we have our foam rolling for our glutes. So this one, I'm crossing my leg over so that I can really focus in on that gluteus maximus. I find it's easier to come down onto your elbow. This way you get a little bit deeper in and you'll start feeling it a lot faster. However, if this is too intense for you, you can always come back up onto your hand. Alright, so for number 2, we are going to do some activation exercises. Activation exercises for today are going to be mostly focused on our glutes, as well as some on the hamstrings, as well as stabilization for our core and our lower back. And this is because our glutes need to be working properly so the hamstrings don't take over, because if the hamstrings take over, then you're going to have issues with your lower back. We do not want that. So for glutes, we're going to be doing glute bridge with a one leg over, and we're doing this so that we can help relax the hip flexors and really focus in on those glutes. Next, we're going to be doing a bird dog, which is going to be helping us with that mind-body connection and really activating that core so that we can stabilize our lower back. So our first activation exercise is going to be our glute bridge with one leg crossed over. And we're doing this crossover so we can focus in more on the glutes and discourage the hamstrings from taking over. You want to feel that full contraction at the top there, slow lowering, and just repeat that. Next we have the bird dog. You want to set up with your hands, same as you would with a push-up position. You're going to extend your opposite arm and opposite leg straight out. You want to keep them nice and tight to the body. And you want to hold that position and feel your low back and your core contract to stabilize while you're in the extended position. Coming in, you can bring your elbow into your knee, slowly, nice and controlled, and then repeat on the other side. So for our hip flexor stretch, we have the couch stretch. For this, we can go either more quad focused or more hip flexor focused. Now to do this, you simply need to move your knee either closer to the wall for more of a quad stretch or further away from the wall for more of a deeper hip flexor stretch. As you move your knee away from the wall and as you feel the tension leave your quads, you can now contract your glutes to really get deep into that hip flexor. You'll feel a difference there. I also recommend using a foam padding of some kind for the knee because the hard ground is quite uncomfortable. And finally, we are going to do our integration sequence. And for this one, we are going to be doing a Romanian deadlift. Now, there are tons of exercises you can do for posterior chain. However, Romanian deadlift is one I personally like a lot because it's quite flexible and we can do it with pretty much any kind of equipment that you have. So for today, we're going to be doing a single leg Romanian deadlift with 2 kettlebells. Just like our regular RDL, this is going to be very similar in the sense that you are lowering and feeling that stretch in your glutes and your hamstrings while keeping those knees soft and not locked out. And once your hips have gone back as far as they can go and you feel that the stretch is moderate to intense, you can stop there and contract the glutes and the hamstrings to reset yourself into the top position. I'm using my back leg here as a stopper just to keep my balance. However, all my weight is going to be in my leading leg. So as I mentioned in the beginning of the video, the Romanian deadlift is not the only hip dominant movement that you can use to train your posterior chain. There are tons of different variations of deadlifts, hip thrusts, glute bridges, etc., that you can integrate into your workout plan. To recap the video, we've got our 3 pillars of training, which is going to be our mobilization and lengthening, our activation, and finally our integration. Now these 3 things are crucial because 1, it's going to help you prevent developing injuries or re-injuring yourself, and 2, this is going to help prevent the development of imbalances, muscular imbalances, or help correct existing muscular imbalances. And finally, 3, it creates a really good baseline for integrating new movements and exercises into your workout plan. Now, thanks for watching, and I hope you guys have a great rest of your day and keep learning.